How is diverticulitis-related vomiting managed? Have you ever wondered how vomiting related to diverticulitis is managed? It's important to understand that managing this symptom involves addressing the underlying inflammation and complications of diverticulitis while ensuring the patient stays hydrated and nourished. The approach can vary based on how severe the diverticulitis is and the overall condition of the patient. For mild or uncomplicated diverticulitis, treatment often begins at home. Patients are usually advised to rest their bowels by starting with a clear liquid diet. This helps reduce irritation in the gastrointestinal tract and can lessen vomiting. Solid foods are generally avoided until symptoms improve. Once the patient feels better, they can gradually reintroduce low-fiber foods before returning to a normal high-fiber diet. Oral antibiotics are often prescribed to tackle any infection, and patients are monitored closely for signs of improvement. However, if the vomiting becomes severe or if the patient cannot tolerate any oral intake due to pain or nausea, hospitalization may be necessary. In the hospital, patients are typically kept nil per os, which means no food or drink by mouth. This allows the bowel to rest and helps prevent further vomiting. During this time, intravenous fluids are given to maintain hydration and correct any electrolyte imbalances caused by vomiting. Broad-spectrum intravenous antibiotics are also administered to control infection. Most patients can expect to see improvement within a few days, including a reduction in vomiting and other symptoms. In cases of complicated diverticulitis, such as when there are abscesses, perforation, or peritonitis, more intensive treatment may be required. Vomiting in these situations is managed as part of a broader critical care approach. This includes bowel rest, intravenous fluids, antibiotics, and possibly surgical intervention if needed. Supportive care can also play a role in managing nausea and vomiting. Antiemetic medications may be used to help control these symptoms, but they are considered adjuncts to the primary treatment of diverticulitis. The main focus remains on effectively treating the diverticulitis and preventing complications that could worsen gastrointestinal symptoms. In summary, managing diverticulitis-related vomiting involves a few key steps. For mild cases, starting with a clear liquid diet and oral antibiotics is common. If vomiting is severe, hospitalization may be necessary, where patients receive intravenous fluids and antibiotics. In complicated cases, surgical intervention may be required. Supportive care, including antiemetics, can also help manage symptoms. Always remember, it is essential to consult healthcare professionals for personalized medical advice tailored to individual circumstances.